Welcome back, guys. My name is Sochuko Jamaraye from Outreach Project for Healthier Communities. I have here with me Fabrice. He's a pharmacist, and he'll be speaking to you guys about how medications can affect your risk for falls. I'll turn it over to him.
Hi, so medications are intended to help us, but sometimes we experience certain side effects with the medications that may be unpleasant with elderly patients because the way they experience some of the side effects that come from these medications are different compared to younger people. They may be taking medications to help with like blood pressure or taking new medications for something like pain. All these medications tend to have certain effect on our body, and our focus is on falls. Things that make you drowsy, for instance, makes it a bit difficult for you to basically maintain or have a good balance, which increases your risk for falls. So main thing is if you're starting a new medication or having changes with your medication, you want to listen to your body. So if you're feeling weak, if you're feeling funny, or if you're just feeling maybe a bit drowsy and you think like you're off your balance, you're not the way you normally feel. The elderly suffer from this a lot more. For instance, if you're taking medications for things like blood pressure, they can make you feel funny, especially when you're just starting or if the medications get changed. And because of that, it can increase your risk for fall. And the other thing is that there are certain medications that actually just target or works on your bones, or some of the side effects affects your bones, so making your bones softer. And by making your bones softer, this actually increases your risk for fall as well. And besides that, just the medications can interact with each other. Most elderly individuals tend to be on multiple medications, and those medications tend to interact with each other. And this can also affect your balance. So it's important to make sure that you go over with a healthcare professional to ensure that they're not increasing your risk for fall. So again, just to summarize, there's certain medications that can affect how alert you are. So you just need to pay attention to these things. And there are other medications that actually can soften your bones, which is not good for you either because it increases your risk for fall. But besides that, it's just the interaction between the different medications that someone may be taking can actually increase their risk of fall, which is why it's important to talk to a healthcare professional to gather more information to ensure that you're not putting yourself or a loved one at this risk.
Well, if you enjoyed that video, tune in. We'll keep the conversation going, and we'll talk more about ways we can prevent falls, okay? So drop a comment and ask questions if you have any, and we'll see you next time.